Hey everyone, welcome. When I was in high school, I knew I wanted more for my future, but I didn't know what more looked like. I grew up in a household where my grandma was a medical assistant and my mom was a receptionist at a cancer center. But of course, with the change in time, they didn't know how to navigate that for me. They didn't know how to guide me. I knew I wanted something in healthcare, but I just didn't know who to seek out. And it wasn't until high school where I became familiar with the Nicholas Academic Center. It was a center that helped guide me. It also funded my undergraduate degree, as well as gave me support, mentorship, and honestly just gave me the need to believe in myself to get to where I am today. But even with all of that, I didn't learn about the true path into being a PA until I got to college and joined clubs and all that. So that raised a really important question to me, as well as my classmates in my group, and that was, how are students even getting that far now? How are they getting this exposure? How can we help facilitate and build that bridge to that gap? Especially since we all came from different backgrounds. We welcome you as we navigate aspiring future medical providers in Santa Ana. So welcome to Santa Ana. And why Santa Ana, you ask? Well, many students are in underserved communities, lack exposure to healthcare careers. Barriers include limited mentorship and guidance, such as in my case, financial and informational challenges, and lack of awareness of such paths. So the purpose of our intervention was to introduce diverse healthcare careers, explain educational paths, and provide resources and guidance to, and ultimately, create opportunity. So off to Alfonso to talk a little bit more about that.
Opportunity doesn't begin in college or even high school. It begins much earlier. As highlighted by Healthy People 2030, one of the key priorities is improving education and workforce development, along with youth engagement. What stands out the most is a focus on the disconnected youth, those who are neither in school or working. And we see that this isn't just a statistic, it reflects a gap in exposure, guidance, and support. When students aren't shown a clear, attainable pathways, we see, especially in healthcare, we see disengagement, both from education and future career goals. Now, when we shift our perspective to underrepresented communities, we see how this gap widens even more. These communities have higher rates of chronic illnesses, limited access to care, and fewer educational resources. Research shows that early exposure to healthcare careers through mentorship, hands-on experience, and ongoing support can significantly increase a student's interest and long-term pursuit of these fields. But in underrepresented communities, that exposure is often missing. Many students grow up without ever meeting a healthcare professional, without access to a structured mentorship, and without guidance on how to navigate the path into these careers. So it's not a lack of potential, it's a lack of opportunity and visibility. At the same time, these are the very same communities experiencing the greatest health disparities. Higher rates of chronic conditions like diabetes, hypertension, and other medical issues. They reflect a deeper systematic barrier, including limited access to care, lower healthcare literacy, and socioeconomic challenges. So what we see here is a cycle. Communities with the greatest health needs are the same ones that are underrepresented the most. And that matters because when patients don't see providers who understand their background, language, or lived experiences, it can impact trust, communication, and ultimately health outcomes.
So now we're back at the Nicholas Academic Center. The center has various centers throughout Santa Ana Unified School District, and for that day, we were at the Centenary High School Library. Again, we aimed our presentation to be literate for 8th grade to 12th grade, but more so focusing in on the 10th through 12th graders. Why, you ask? Because it is a critical stage for career decision making, as well as a good age for mentorship. Our goals were to create awareness as well as confidence and access to these various healthcare careers. We empowered students to pursue these careers, as well as supported a more diverse healthcare workforce by aiming at a population that we want to enter the workforce. So Steven's going to talk to you a little bit more about how we did that.
For health literacy and communications fields, we intentionally designed the workshop so that students grades 8 through 12 can understand the information regardless of any prior exposure to healthcare careers. Many of the students may not have family members in healthcare or be familiar with medical terminology. So because of that, we used plain language and avoided any unnecessary medical jargon. We broke down each healthcare career into simple step-by-step roadmaps that included information ranging from scope of practice, college, required classes, healthcare experience, and graduate schools. We use small breakout sessions so students can ask questions more comfortably and participate in active learning. Our goal was to make the workshop understandable, engaging, and realistic for students at different grade levels. Some of the examples we used were we avoided prerequisites, instead used phrases such as classes you need before applying, we avoided clinical hours, and instead used hands-on patient care experience. Cultural humility and communication were key components on how we approached this project. We recognize that students at the Nicholas Academic Center may not have equal access to knowledge, mentorship, or financial support. So because of this, we intentionally avoided assuming the students already understood how to navigate the healthcare pathways careers. Instead, we acknowledge the real structural barriers that underserved students face, such as cost of education, being first-generation students, and having limited exposure to different healthcare professions. We emphasize that there are multiple pathways into healthcare and there is no one right way to do so. Students can begin roles such as medical assistants, EMT, and then transition into more advanced roles later in life if they choose to do so. They have the option also to go to a community college and then transfer to a university. This is important because it validates non-traditional pathways and reduces the idea that success only happens through one linear route. This project also served as a form of advocacy. By introducing early exposure to healthcare careers, students are able to gain knowledge in those careers and then make a proper decision in the right job that is right for them. We promoted pipeline development for underserved communities by tailoring our workshop to be both inspirational and offer practical guidance. We showed students that the educational steps in different healthcare careers, time commitment, and financial considerations when entering the healthcare workforce. So why does this matter? Providing early guidance allows to reduce any barriers, improve opportunity awareness, and support long-term equity for underserved students. Also, NAC is already a community-based resource center that supports students, so working with this program made our outreach even more relevant and helps build trust.
Before presentations, we had students complete a short survey as well as a post-survey after presentations were completed. This allowed us to directly measure how much knowledge they gained and evaluate the effectiveness of our session. Looking at these results, we assess how well students were able to correctly identify the roles of different healthcare professionals. This is important because understanding each role helps students see how healthcare teams function and where they might fit within that team. Across all professions, we saw a clear improvement. For example, correct identification of medical assistants increased from 18 to 30 students, which is about 67% increase, and registered nurses increased by about 60%. The largest gains were seen in nurse practitioners and PAs, both of which were more than doubled. These are often the most misunderstood roles, so this suggests that our presentation was especially effective in clarifying those distinctions. Here we evaluated students' ability to correctly match healthcare careers with their minimum education requirement. This is important because understanding the educational pathways helps students realistically plan their goals and recognize what steps are needed to reach a specific career. Before the presentation, only 9 students answered correctly. Afterwards, that number increased to 26 students, nearly tripling. This highlights that while students may recognize different healthcare careers, they often don't fully understand the path that it takes to get there. After the presentation, students left with a much clearer understanding of the educational requirements for these professions. Next, we looked at how students' confidence changed after the presentation. Confidence makes students more likely to pursue careers they feel knowledgeable and capable of achieving. Before, most students reported lower confidence levels. Afterwards, we saw a clear shift towards higher confidence. The number of students who felt somewhat confident increased from 4 to 16, and those who felt very confident increased from 3 to 8. At the same time, the number of students who felt not confident decreased significantly. This shows that our presentation didn't just improve knowledge, it also helps students feel more confident in understanding and exploring healthcare careers.
Looking at our pre- and post-survey results, we saw a significant increase in students' awareness of healthcare resources. Before the intervention, shown in green, only about 14% of students could identify at least 2 credible resources. After the presentation, this increased to 80%, showing a substantial improvement. One important correlation we observed is between resource awareness and confidence. As students became more aware of available resources, we also saw a decrease in low confidence and an increase in students reporting higher confidence. This suggests that knowing where to go for help may directly support students' belief in their ability to pursue a healthcare career. These results were expected since providing resources was a core part of our intervention. What was somewhat unexpected was the magnitude of the increase from 14% to 80%, which suggests that students had a much greater initial gap in access than we anticipated. Overall, this demonstrates that improving access to information is a critical factor in supporting underserved students in exploring healthcare careers. Looking at our student interest, the pre and post surveys also showed a positive shift. After the intervention, more students reported being very interested in healthcare careers, while fewer students reported low interest. One key correlation we observe is between career knowledge and interest. As students gain a better understanding of different healthcare roles, their interest increased. This suggests that exposure plays a major role in shaping career motivation. Another correlation is between confidence and interest. As students became more confident in their ability to pursue a healthcare career, their level of interest also increased. This indicates that confidence may act as a motivator for career consideration. These results were largely expected, as increasing awareness and confidence were intended outcomes of the intervention. One unexpected observation is that while interest increased overall, not all students shifted to very interested, suggesting that additional factors such as personal circumstances or long-term support may influence sustained interest. Overall, these findings show that the intervention not only improved knowledge, but also positively influenced students' attitudes and motivation towards healthcare careers. Our project has multiple objectives. Our analysis shows that all of our project objectives were successfully met or exceeded. For our first objective, which was for at least 75% of students to identify multiple healthcare careers and their roles, we saw clear improvement in career knowledge. The number of students correctly identifying roles like nurse practitioners and physician assistants increased significantly, showing that students gain a stronger understanding of healthcare careers. For the second objective, focus on education pathways, we exceeded our 70% target. The number of students who could correctly identify a pathway increased from 9 to 26, indicating that students left with a much clearer understanding of steps required to enter these professions. For the third objective, which aimed for at least 65% of students to report increased confidence, we observed a major shift. The number of students who reported low confidence dropped significantly, while those reporting higher confidence increased, demonstrating that the workshop effectively built self-confidence. For the fourth objective related to resource awareness, we also exceeded our goal. Students who could identify at least 2 credible sources increased from 14% to 80%, which is a substantial improvement and critical for long-term success. Overall, these results show that the intervention was highly effective in achieving its goal and had a meaningful impact on students by increasing awareness, confidence, and access to healthcare career pathways, ultimately supporting students in moving from awareness to opportunity.
And of course, with any project, we face a few challenges along the way, which I'll be discussing, as well as the solutions that we identified moving forward. One of the main challenges we faced was communication. There were delays in receiving responses from the site, which made it difficult to coordinate effectively and limited our ability to schedule multiple sessions, which impacted the scope of our intervention. Another challenge was time constraints. Due to site's transportation schedule and structured programming, we had a limited window to engage with the students. And while we made the most of that time, it did restrict with how in-depth and interactive we could have been. Another factor was attendance. Many of the students were seniors with senior obligations that same day, which resulted in a smaller group than what we had originally anticipated.
But despite this, we were still able to connect with those students who were able to attend. And in response to these challenges, we identified several important solutions moving forward. First, improving coordination and establishing earlier, more consistent communication with the site would help ensure smoother planning and potentially allow for multiple sessions. We also recognize that while one session is impactful, it's just not enough on its own. However, this intervention did serve as an important starting point where we were able to plant a seed by establishing a connection between the NAC Academy and USC, which can be built upon for future programming. We also introduced students to the USCPA Pathway programs as a way to create a bridge for continued exposure and opportunity. And by sharing these resources and leaving our contact information, we aim to provide ongoing support and maintain these connections just beyond this one visit. Overall, despite the challenges that we faced, this experience reinforced the importance of early exposure, mentorship, and accessibility in shaping future healthcare professionals. Even a single interaction can spark interest and open doors, and our hope is that this initiative not only made an impact on the students that we met, but also laid the groundwork for stronger partnerships and more sustainable outreach efforts in the future. Thank you for watching.